So if we talk about healthcare, there are three A's are there. So one is basically awareness, affordability, availability, and we also say the fourth A is accessibility.
International Biodesign, Synergizing Healthcare Innovation and Entrepreneurship, SIB-SHInE, is an exciting year-long full-time dedicated residential fellowship program jointly led by the Indian Institute of Technology, Kanpur, and King George's Medical University, Lucknow. It is sponsored by the Department of Biotechnology, Government of India. It serves to launch Made in India biomedical innovations through its 4C academic program encompassing clinical immersion, conception, creation, and corroboration. Biopatrika is proud to partner with IIT Kanpur and KGMU in welcoming the inaugural batch of this year's fellows. Aditya Bhatia used his master's in hospital administration and vast experience to manage economic and business activities in healthcare setups. He has now set sights on solving root healthcare problems in India with the objective of providing healthcare for all. Congratulations, Aditya, and welcome to the SIB-SHInE program.
Thank you. It's a privilege and an opportunity to interact with you.
This is a unique opportunity to really be at the precipice of medtech innovation. What specifically attracted you to this fellowship?
So, if we say this fellowship is an interaction between engineering and medical. So, if you go into the fellowship program, so normally the fellowships happen at only one end, but with the joint venture between two premium institutions, where the medical healthcare problems are being given by the doctors, their pain points, and we have an interaction with them. And the another end, we are getting it solved by an engineers. So IIT Kanpur in itself is a premier institutions. So when they both join hand together and fellows like us, if gets an opportunity to do this kind of fellowship, I think so it's again a wonderful opportunity, and I'm enjoying this journey by interacting with so many people.
So what is the caveat in Indian medical technology innovation that you would like to focus on?
So if we talk about healthcare, there are three A's are there. So one is basically awareness, affordability, availability, and we also say the fourth A is accessibility. So on these four A's, if we work upon each A in itself has a brief and a deep component into it. So as I have a passion for preventive healthcare and I want that there should be an awareness programs, there should be an access to rural people so that they can know that these kind of healthcare services are there in India. For example, as I'm in KGMU, I saw there are around 4,000 beds and 700 EICU beds being in the hospital. But still, the rural people are getting afraid that what kind of services will be there and what kind of privileges will be they getting. So I think so again, a huge connect has to be there with a lot of accessibility, awareness, and the most important thing is the affordability. The kind of healthcare services being offered in these government setups are excellent and far more better than the private setups. But again, the mindset, the awareness has to be there that no doubt there is a little bit of rush, but as compared to private, if you see the pricing factors, there is again a huge difference. So I think so again, I'm working on these factors and hope so get more inclusive healthcare programs related to these things.
What is a special skill that you bring to the table to answer this drawback?
So if we go back to any program that is more related to preventive or related to healthcare, there were challenges, there were solutions. But as a fellow and doing a fellowship, I think so I will be, as from management background, will be bringing in connect and collaboration, because doctors in itself are super busy and engineers are always involved into their own intelligence and their innovations. So I think so if a connect and collaboration between these two premier institutions, or we can say the two premium fields like the medical and engineering, through a bridge of management, if it can be done, I think so I will be doing a great job by connecting and collaborating with them.
So what kind of collaborations do you foresee for your initiative? And do you think that you would build a partnership with any of the other 8 fellows in the program?
Yeah, that's what we are. Still, we are into a certain kind of, because just it's the beginning of the fellowship program, and we having being a lot of interactions. We are having a lot of activities being going on. So no doubt there are certain people who want to work on technology. There are certain people who work on medical products. There are certain people who want some awareness programs. So still there are certain people are there whom I have got the certain wavelength, and we are trying to design a certain kind of protocol so that the fellows, the doctors, and the engineers can form a team. So it's in a very initial phase, and I think so, because as in management, without team nothing works. So we are in that formation of it, and I think so great teams make things great happen.
Did you come into this program prepared with a particular innovation idea, or are you using the clinical immersion phase to really formulate one?
No, I didn't came with any idea, but as I've always been innovative and a very jugadu person, so I always wanted to have certain kind of things, because in healthcare, when I'm being into healthcare administration from the last 13 years, so I'm seeing that a lot of jugad is happening, but that jugad is happening not in a formal setups, in a very informal setups. And if that kind of innovation happens in a proper mechanism and it is being spread and given to every person, so I think so that will bring again great, we can say, a connectivity program. So that is my main concern. And I did not came with any idea, with any innovation, but again, the kind of clinical immersion program is happening. I think so, interacting with doctors and just having a knowledge, because you'd never know what kind of problem and pain problem with by. For example, if we are going through an emergency and we see that patients are moving away from the trolley and the kind of mechanism is happening, so when the idea can stuck upon, you never know. So it's a great, I think so, immersion program that the fellowship program has designed. I think so it's a wonderful opportunity for us also, that we are getting to interact with the faculties and with the HODs and professors of such high rank and with a very short notice. And they are giving a very great welcome to all of us, and they feel that we can do wonders. And I think so it will be our, we can say, a opportunity if we prove them right.
So, why did you choose this immersive program instead of working on your innovation and ideas part time?
So again, the thing is there because as I told, it's all about connection, collaboration, interactions. So already I had certain things that these are kind of innovations are happening. But once you interact with the senior peoples and you get their experience, and we put in our youth energy with their experience, and that both things are again collaborated together. So I think so they can act wonders, because they have already made an experience. They have know that these are the pain points, and with our energy, with our time and efforts, I think so we can again do a great wonderful job by solving the healthcare problems of our nation.
1 year down the line at the end of the fellowship, where do you see yourself?
So I see in a very, can say, I don't remember the exact name of the aeroplane, so which flies very high and which has a very good speed. So as a pilot of that aeroplane, I see that I am going to fly high, and I am again going to create a new benchmark and new setup. So because the kind of interactions are happening and the kind of mindset is changing, I think so. Whenever we'll see a new healthcare problem, so there will be so many dots behind us when we'll see, okay, this thing happened by this way. I think so we'll be creating a such so many solutions. Even though right now we are doing immersion programs, we might be getting around 100 to 200 pain problems. But again, we are not solving each pain problems. But again, we are having a discussion on each pain problem so that we filter down. So after 1 year, if we say, okay, whenever we go to a certain department, we can, okay, jot down, okay, these were the problems, and we had discussed something, so we can give a solution to those things. So again, it's adding wings to myself after 1 year. Not only after 1 year, I think so the program I have joined, I have already added the wings, and now I'm going to mature it after 1 year.
Very progressive thought. Excellent. And we're excited and looking forward to your brilliant innovation and ideas. Thank you, Aditya, for speaking with us today.
And thank you for interacting with all our fellows and myself. And I think so it's a great opportunity so that we can again connect and we can do great wonders to our nation.